Bismillahirrahmanirrahim, respected audience, Assalamu alaikum. Today, the topic of my discussion is atopic keratoconjunctivitis with a case of limbal stem cell deficiency. So, this is a patient who presented to our emergency with decreased vision, pain, photophobia, redness in the eye, and on examination he had a central big corneal ulcer. You can see which is staining positively, and 360 degrees there is corneal neovascularization. This is another picture, anterior segment photograph of this same patient. You can see here that how much there is ciliary inflammation, congestion, and all the blood vessels are congested over there. This is the superior area, again deep ciliary congestion, and you can see that superior part of the corneal ulcer, how much extended it is, and the discharge was minimal, and there were no signs of infection. If I talk purulent discharge like this, nothing. It was not like that. Just this was redness, inflamed eye, and this is a superior part of the eye wall. This is the temporal area. You can see how the blood vessels are encroaching and passing the limbus. Is a superficial vascularization and going up to the center, and even the temporal conjunctiva, the bulbar conjunctiva, is highly inflamed and red. Atopic keratoconjunctivitis is basically a non-infectious corneal inflammation of ocular surface. Atopic keratoconjunctivitis has high association with atopic dermatitis. The patients who are having atopic keratoconjunctivitis, and 95% of them can have association with the skin manifestations and atopic dermatitis. While the patients who are atopic dermatitis, in them the chances of developing keratoconjunctivitis is 20 to 40%. So as I mentioned earlier and showed you the different photographs, different sides of that patient, so that patient presented us with severe pain, photophobia, decreased vision, and ropey-like discharge, and the vision was decreased to counting finger 2 feet in the right eye. The IOP was normal, and he came to our emergency. So as our protocol is, the patient coming with corneal ulcer, we try to go first of all for the culture and sensitivity, gram staining, ginger staining, to see any infective element is there or not. So this patient also underwent the culture and sensitivity, conjunctival swabs, and corneal swabs, and after that we also did his B scan to see the involvement of vitreous, so that much retina, but it was negative. Then there was no infection involving the posterior segment. And later on, when we got the report of this patient, it was methicillin resistant Staphylococcus aureus. Usually atopic keratoconjunctivitis patients have high chances of having infections with Staph aureus and herpes virus infections. So this was the patient. So we, as per this culture and sensitivity report, took some time to come, but we started him on antibiotics, moxifloxacin eye drops, and cycloplegic eye drops, and fortified eye drops. And once the report came, it was sensitive to vancomycin, so vancomycin fortified eye drops were added, and the patient was closely monitored, and later on this corneal ulcer healed gradually. But this patient we kept on following, and he has the history of recurrent corneal ulcers and SPKs. As I mentioned earlier, once the infection was settled, once the corneal ulcer healed properly, and the course of antibiotics was done, we put this patient later on the fluorometholone eye drops to control the inflammation as much as possible, and we also introduced a course of topical tacrolimus eye drops. Tacrolimus eye drops have a special role in controlling this type of inflammation, and this is used for a long time period to control this inflammation. So as I mentioned earlier, we followed up this patient, and this is the latest anterior segment photograph of the patient. You can see that a corneal ulcer has healed. The patient has SPKs, extensive SPKs, even in the both eyes, and there was neovascularization which was still prevalent over there. This is another slit lamp examination photograph. Here again you can see the staining, but I request my respected audience to concentrate on the pattern of staining in the periphery, how the staining is happening along the blood vessels, and I will show you its significance in the coming slides. This is another latest anterior segment photograph showing the staining. The ulcer is no more there, but epithelial lesions, punctate epithelial erosions, which are confluent together, they are present still and taking up the stain, and the blood vessels are not that much aggressive as they were before. I showed you the earlier his photographs. They are still prevalent, but their intensity has decreased. And if you please concentrate on the conjunctival congestion, that has also been controlled. It is no more that much inflamed and hyperemic. Yes, this is the slide, the latest slide. Here you can observe the pattern of staining. This is the pattern of staining along the blood vessels. It is called waterfall sign. The limbal stem cell deficiency cases ultimately develop such pattern of staining. The erosions and these staining patterns make up something like that along the blood vessels. It causes staining. So basically, atopic keratoconjunctivitis is a very challenging disease. If not properly managed, that patient would have gone further corneal thinning, and it can even lead to corneal perforation. It is a non-infective condition usually, and the discharge is ropey-like. So the management is very important to control the perforation, and if things go towards that, sometimes we need the help of amniotic membrane to close and cover the lesion. So tacrolimus eye drops have a special role to control this patient long term, because this disease is immunological disease. It comes, it flares up, it settles down, it flares up, and it settles down. And in this specific case, I showed you that as the limbal stem cell deficiency has happened over there, so these patients develop new vascularization. The new vascularization you saw 360 degree is an effort from the eye part to control this lesion. This is a reaction from the body. So if this stem cell deficiency is there, if the other eye is normal, sometimes limbal stem cell transplantation even can be attempted if there is a deficiency. But if both eyes are affected and both eyes are involved, then limbal stem cell transplantation is another challenging issue. So that was a very interesting case which we followed up, which we treated from corneal ulcer, its management, and later on now she's on maintenance dose of tacrolimus and eye drops and lubricants. So I wanted to share it with you. I hope it will be very beneficial for my respected audience. Thank you.